it's the reason I'm taking this action. Just like I've continued to tell people, I'm following the data, I'm following the advice of Dr. Toomey. Her and I both mentioned in our remarks, finding out that this virus is now transmitting before people see signs. So what we've been telling people from directives from the CDC for weeks now, that if you start feeling bad, stay home. Those individuals could have been infecting people before they ever felt bad. Well, we didn't know that until the last 24 hours. Those individuals could have been infecting people before they ever felt bad. Well, we didn't know that until the last 24 hours. And as Dr. Toomey told me, she goes, "This is a game changer."
Yep, I just said that.
I'm Brian Kemp.
Equipment, are we talking about face masks and that sort of thing?
Yeah. Great. Let me ask Dr. Fauci perhaps, and then Dr. Hahn.
So, anecdotally, it's clear that there are people who were judged to be asymptomatic when questioned, who very likely transmitted infection during the period of time that they were in the asymptomatic state. And we know that there are individuals who are actually able to transmit when they are without symptoms before they get symptoms.
And if the chauffeur does not show any symptoms, he's still contagious. He
could also be contagious too, and that's one of the things that's challenging here is you and I might get exposed to somebody who is totally asymptomatic, no symptoms. That virus would appear, well, that's not a very strong virus, but in fact, when it infects us, it could kill us.
Asymptomatic transmission is possible. Reports out of China looked at more than 70,000 individuals with this infection and found.
That's an excellent question. Just because you feel better or feel well does not mean that you're not shedding virus.
So are they a group that are potentially asymptomatic and spreading the virus?
I got a big truck.
In many places in Washington, D.C., and a new study suggests that it's young Americans who aren't really showing the symptoms that could really be spreading this and putting older Americans in jeopardy, more so than we realize. Would you like to see a national lockdown? Basically, people, you can't go out to restaurants, bars, you need to stay home?
Well, I would like to see a dramatic diminution of the personal interaction that we see in restaurants and in bars. Whatever it takes to do that, that's what I'd like to see.
It's important for the young and healthy people to understand that while they may experience milder symptoms, they can easily spread this virus, and they will spread it indeed, putting countless others in harm's way. We especially worry about our senior citizens.
The reason we're taking these strong and bold steps is because we know there is virus spread before you develop symptoms, and then we know that there's a large group, we don't know the precise percent yet, that actually is asymptomatic or has such mild cases that they continue to spread the virus. We're asking the younger generations to stop going out in public places, to bars and restaurants, and spreading asymptomatic virus onto countertops and knobs and grocery stores and grocery carts.
Even if you feel healthy and are asymptomatic, you can be carrying COVID-19 and spreading it.
The coronavirus is about 3 times more contagious than the flu, according to our best estimate. And you can contract the coronavirus, have very mild symptoms, if any, not even be aware that you have it, and expose someone who is vulnerable to a very serious health outcome.
Because we have been saying that there is a level of asymptomatic or mild spread. And that's why each person has to be responsible.
This disease can go asymptomatic in certain people, and in those asymptomatic people, they may be in fact spreading it even though they don't have symptoms. And so
transmission, but these community interventions will be our best bet there.
Yeah, we're hearing that folks who are asymptomatic can spread this, young people in particular, it would seem, because they seem not to be affected as badly. If that's the case, why wouldn't it make sense to test more widely to make sure that asymptomatic people aren't spreading this virus?
Well, obviously, the more you test, the better it would be. We are limited, as is every other state, by the number of tests we have. And I want to say something about young people. They do acquire the virus. They think they're immune, but they're not.
Right.
They do have symptoms. They may not recognize it as as something serious because 80% of coronavirus cases are relatively mild, like the flu or even less severe. Okay. It's that 20% of cases that are very severe, particularly in the elderly, particularly in those with chronic health conditions that we're trying to prevent right now.
All right.